During the time that I was trained, I have a lot of friends being the LGBTQ communities. And the main thing, the most very common complaint from them, like, nobody cared about them. When I study more, read more, it's totally different. If you are not a transgender people, or if you don't have anybody in your family has transgender people, you will never see this issue is important. But if this happened to you, or if this happened to you, the one who you love, with your kids, your family, and you see them suffer from that discomfort of being stuck in the body that not belong to them, you will change the way you think that this is necessary for them.
I think my dad, he noticed I'm different. I'm not like a son. I'm not his ideal son. It's struggling at first because I have fight with him because he still have a chance to change me. So he sent me to practice boxing in my village in order to hoping if I doing some masculine stuff, it might change me in the future. Hanging out with a lot of guys might help me, but it's not. I don't want to lie anyone, especially myself, because I know I am a woman with the heart. Even I was born as a male, but the strong feeling inside just telling me you are a woman.
Good thing with my family, even if I am a transgender at a very young age, they already knew that I will be growing up as a transgender. During that time, sometimes my mom, she was afraid that I will be growing up like this because, the culture in the Philippines, when you are growing old as a gay or a transgender, no one will be there for you. But during my high school days, my mom, she's also buying, instead of buying me a brief, just buying me a panty, she started to support me for the way how I am. Way back when I was at first year high school, there's a lot of saying that when you're going to high school, you will be bullied by the gangsters or most of the boys. We break the stigma as well, because even if I am a gay, I was able to snatch the top 2 or achievers in our school. So at the time, most of the boys in our class, instead of bullying gays like me, they already knew that, oh, they are intelligent, so we can make friends with them because they will be helping us with the subject. Sometimes they're using that, If you have a kids or a member of LGBT in the family, sometimes they are the silver lining or the future, or the one who will live our family needs in the futures.
A lot of people may think that Thai culture is very accepting to LGBT people. From my experience and also from working with transgender community for a really long time, I think different. Thai culture is not accepting. Thai culture is tolerant. What is mean by tolerant is mean that you can be whoever you want to be, but you cannot be a part of my family. You cannot be a part of people who close to me or people who close to my family. So gender affirming care is not only one procedure. I think it's very important to see gender affirming care is the ongoing process. If gender affirming care have two categories, the first category is medical based and the other is non-medical. The medical base including the sex reassignment surgery, top surgery, breast augmentation, body control, facial feminization, facial masculinization. For non-medical, it's more like, access to mental health providers, access to psychologists.
Transgender health, we might say it's new, but all the practices that's recommended in gender-affirming care is actually very similar to what we usually do for cisgender people. The medical education is actually genderless. Okay? When we talk about physiology, although we talk about male and female physiology, we don't talk about men and women gender. We don't talk about masculine circulation of the blood. Basically, medical education should be genderless. That is an important feature of this field of education that will make transgender health easily accepted, okay, and included in the curriculum. Just focusing more on transgender individuals and gender dysphoric individuals would already be a shift towards transgender health. And that would be a good addition to to the medical curriculum. Okay? And that will make the medical curriculum more inclusive. When we talk about the Philippine Professional Association for Transgender Health, if we're going to come up with our own clinical practice guidelines, in order for it to be accepted in the Philippine medical practice, we have to affiliate as an organization also first with the Philippine Medical Association, which is the mother association of all medical practitioners in the Philippines. We're working on that, and then after that, also give officially lectures for continuing medical education, which includes transgender health for primary practitioners. The goal is to include primary level transgender healthcare lectures for the municipal health officers, the doctors in the barrios, the doctors in the towns, smaller towns, as well as in the cities around the Philippines. Because the Philippine health system is shifting to the universal health care, where all patients will be seen at the level of the primary care first before they get to be referred to the specialist. Our target primarily are the primary healthcare providers, the family medicine practitioners, the general practitioners, and of course all the allied medical professionals also. It's not just about the treatment per se, but more of course providing a safe space also in the clinical environment for transgender men and women, because even if you know how to treat them or provide them gender affirming care, if your space, your primary space, your clinic is not welcoming, it will be difficult to get your clients.
Hormone therapy for transgender people, we call gender affirming hormone therapy. So gender affirming hormone therapy is the treatment that we provide for anybody who has discrepancy between the sex assigned at birth and your gender identity. Gender affirming treatment is a big picture. A gender affirming hormone therapy is one treatment under the gender affirming treatment. The ultimate goal, we like to change the body that doesn't fit your own identity to be, the same as your identity. If you like to be more feminine, we give the hormone that make your body change to be more feminine. Or if you like to be, more masculine, we give you a hormone to make your body change to masculinity. When I was trained in US, I went to the medical conference, like a hormone medical conference, and I practiced in the transgender medicine. There's like a very small section, we have a big group of diabetes, a big group of thyroid, a very small group of transgender people. And that's kind of like make me want to know more how we doing in Thailand in terms of transgender care. So I would say the transgender field has been growing worldwide, globally, in Thailand as well. For the past 5 to 6 years, recently, we have more provider or more hospitals that start doing the transgender care. I think Pride Clinic is one of the pioneers that we're trying to grouping all the specialists that provide the care here.
Based on the statistics, okay, of course, the percentage of the patients I get is around 85% to 95% transgender. It's that huge. Whenever I try to tell that to other people, they'd be like, really, there's that much transgender? I'm like, yes. Mostly I focus on the breast surgeries. There's a lot of individuals that are actually embracing the fact that they can actually do the surgeries, and I love that because surgeries are safer. Before, they were exposed to the non-surgical ways being done by non-medical professionals, but because of social media, they can see that there are actually people who do the surgeries, who care for them. So I try to be with them in their journey, and I also promise them if they get problems in the future, I will always be here. The purpose of this is getting these individuals access healthcare wherein they don't have to go abroad. They have the international standards right within their doorsteps. A lot of younger people are transitioning very early on. They start with the hormones. Hormones are now easily accessible.
Right now, I am a co-founder of Young Pride Club, the club that pushes for gender equality in the youth since 2018, and build the leadership for them and arrange the big event like Chiang Mai Pride 2019 until now. My household or my family, they allow me to be a trans woman. They knew like I want to be a woman, so that they always support me all the way that I want. Back then at that time, my grandmom, she always bring me to the local market, and she bought the lipstick for me a lot, so that I start to collect my lipstick. But when I went to the school with my body, different body type, different gender identity, different how to expression, I got bullied a lot from the student, like, oh, you are the big show, the Japanese boxer. I've heard it every day, so that it's kind of lack of motivation to learning as well. But I have to maintain my grade because in the rural area society, if you have a good grade, every people will admire you. You know that I never ever meet the Thai guys who flirt me in person, just the online platform. But when I went to the US as an exchange student, some of the US Mexican guy was flirt me. I just felt the moment that I gain a love by in person, so that at that time I don't know how to deal with myself. This is my first time in my life.
In the discussions about the use of hormones and medical conditions associated with it, liver is not actually one of the major health concerns. But of course, hypothetically, when you take in any medication, it gets to be detoxified by the liver. And of course, talking about hormones, the prototypes being the contraceptive hormones, they are known to cause liver damage. But the forms of hormones that are recommended in gender-affirming hormone therapy is safe for the liver, talking about their dose. And we actually have transdermal delivery system, which would not circulate anymore in the liver, but directly gets its effect into the tissues. So the liver will not have any damage with the use of transdermal system delivery. For testosterone, all the testosterone that's recommended for use for trans men are injectable. So it doesn't pass through the liver because the level of hormones that we are actually administering our patients, or I myself is taking, is at a therapeutic dose, meaning it's a safe dose. So going beyond, of course, and going below, that would be dangerous. So we have to maintain that level. And of course, we get to be guided by the determination in the blood. So we have to maintain a normal level in the blood of the hormones. One form of gender-affirming hormone therapy, combined oral contraceptive pills, which also has an ethinyl estradiol component. So there are two. So the ethinyl estradiol is the estrogen content, and the cyproterone is the prototype anti-androgen. That is a progesterone. So when you take that, you will have the targeted effect for trans women, which is anti-testosterone and the secondary sexual characteristics for women, which is, of course, estrogen. But what's unfortunate about the use of combined oral contraceptive pills is that you cannot take it more than once a day. But in gender-affirming hormone therapy, in the past years, we tend to take it more than once a day. So that could cause liver damage. It has been implicated in causing DVTs, and of course cardiovascular diseases. Very high risk for stroke and myocardial infarction. So now the recommendation is not to recommend it anymore.
If the question regarding what age for the kid could start with the transgender care, so I would say there's not a lot of data to tease out, what is the appropriate age for everybody that we feel safe. We feel that if they grow enough, they know enough to start the hormone therapy. But I would say the way that we provide care for adolescent or kids is different with adult. Okay, so with the adult, you have lived your life for some period of time, your gender kind of like persistent. So in the first visit, when I talk to adult transgender people, we get some history. So the history is quite the same. They know gender dysphoria for a long time, they know they're transgender people for a long time, so that's easy. So we can start the treatment right away. But for adolescent, I would say we still think that this age is a very complicated. So we need a team, like a whole team. Not just me, the hormone doctor. We need a mental health provider. We need adolescent medicine or the kid doctor to evaluate them. We need family or a caregiver who know them very well. We take care of them as a group, and we make a decision together. Right? So, like I said, there's no magic age, but we evaluate as a team when the appropriate age, whatever it comes, that's a time for them. Okay, but the magic number for now we adopt from the guideline, the international guideline, that's 16 years old. It's a time that we consider that might be high enough to start a gender-affirming hormone therapy. If they came to get a consultation less than 16 years old, we have a treatment called puberty blocker. We give them the puberty blocker just to freeze that puberty, because that's the cause of dysphoria, of discomfort. I remember one of my transgender women under my care, she came to see me and she told me that, you know what, I have been waiting a doctor like you for my life.
For about trans healthcare, I think CISA is the one of organization who also advocate about policy or something, policy change for better healthcare access, even about treatment and also about gender recognition. For trans people who want to get a treatment or want to test for HIV or hormone therapy, And yes, I think that it's lucky to have a sister foundation because the knowledge of transgender is specific. So I think general hospital cannot provide general specific information to trans people. The reason that I work in here because at the first reason is I am trans. So I want to work for support our community, and also I am the one of many people, trans people that also face about the same problem. So I want to address the problem, even policy, even human rights, or even anything, any issues for get better in our community. For Sister Foundation, it's not only healthcare for provide for service to trans community. We also provide about mental health. This is important part for trans people, and also about counseling to trans people, and also occupational training and human rights abuse. So we try to advocate and try to help and support for trans community. I realized that Sister Foundation have a valuable job, valuable work for trans community. So if you come to Pattaya or visit to Pattaya, I would like you to visit to Sister Foundation because it's the first organization to support about trans community in Thailand. And we try to fulfill, even you are not Thai people, we also try to fulfill about your life.
I think the first and foremost of being trans, we always have fear. If you look like, oh, really like a real woman or something like that, you're gonna get a free pass in society. But if you're not looking like that, you're gonna face a lot of discrimination. People gonna like asking you question, are you a trans woman? What are you? Something like that. Out on the street, you know, people just curious and they just come up and then they take up on my personal space and then just invading. It's not easier for trans people to apply for job and get accepted because like brand and corporate world, if they can pick, they would love to pick a man in a suit or a woman with a beautiful figure. And trans are like the bottom of the barrier, so that's why a lot of trans people struggle economically. I feel like the old system of the world is breaking down, like the gender, a lot of stuff, you know. In the future, I think we will be more liberating. And I hope in the future we all can accompany ourselves. It doesn't matter if a race, religions, or like a gender expression. I hope we can find some common ground and share the space in this earth together. For some jobs, they are announced publicly. They are not allow transgender women or trans men to apply this position. If we want to take that job or position, we have to dress up that match with our gender that we assign at birth. That's why a lot of transgender people, especially trans women, they end up working as a sex worker. Not because they want to do that, but social just eliminate them to get a proper job or a job they want to do. In Thailand, the most dream job for both cisgenders and transgender people is flight attendant. I used to apply this job and the recruiter just told me, I think you have the potential to be a flight attendant, you're optimistic and you're cheerful and you are happy to take care of people. There is only one reason I wanna ask you, can you change your gender identity, live your life as a gay? I might take you. It was hurt for me because why? Does passengers gonna take a look at what do you have under your skirt? You have to look on their ability, not their gender.
In Thailand, there is no legal gender recognition for trans people. What is meant by legal gender recognition is you're a transgender woman. You cannot change your gender marker in your official document. For example, your ID card, your passport. Still, if you're a trans woman, you still have Mr. as your gender marker. So, is there anything that prevent transgender to access to these fundamental rights? So when I live in the US, or if you're on Medicaid, for those who have low income, they help you pay for gender affirming surgeries. I can see that because I'm working with a lot of transgender and non-binary people, clients who come to the community health clinic that I'm working with. My role was to generate the letter, the insurance letter for their provider to sign, and then they can use this letter as a proof for their insurance, and their insurance is going to help them pay for all the surgeries they want to do. But here in Thailand, trans people have to pay out of their own pocket. And when I think about it, I feel like this is injustice, because not every trans people have money to pay for this kind of procedure, and these procedures are very, very expensive. But for Thai people themselves, some of them cannot even imagine that they can access to this. Access to gender affirming surgery can be a life-changing for a lot of trans people. For trans people, we want to feel that the body we have matching with the gender identity that we have. I met these female monks, from this group that I'm working with. At first, I and my colleague asked her if transgender people can ordain to be a monk. And these female monks responded to me that, no, you cannot. You're not a man, no, you're a woman. You cannot ordain. But working with this group for a year, sitting, talking, discussing on gender equality, for LGBT, create the space where we can sit and talk together. I asked her the same question again. She said that maybe transgender women can ordain, but as the novice, not a monk yet. So you see from this story, I think people can change, but it takes time. It does take time to change. And for my activism throughout my life, for almost 20 years of my activisms, I can see that, we can change. Ourselves, me, not no one else, can learn to love myself.
In Thailand, we are blessed with the ability, like we can grow up, and if we are more like a trans masculine person, we can present ourselves like this, even before the medical transition, even before the hormone or any gender affirming surgery. So it was not like a wow from a very beautiful lady, which I was, until like a gentleman like myself now. Before I had the transition, who do I ask? No one, nobody. It was purely my own decision. Maybe because I'm an academic type, I did a lot of research and I know what I'm doing, and maybe it's because of my age, I have seen the world enough so that I know this is what I want. And maybe because I've done a lot of mindfulness practice, I'm very focused on what I think is one of my life's goals. So at that time, I made a decision myself, but it was a very tough decision because, like you can imagine, you would literally change from one person to another person. But maybe because we are in the Buddhist country, we are very familiar with the idea of reincarnation. So for me, it's just like I was born again in the same lifetime.
In Thailand, gender affirming surgery, GAS, or sexual reassignment surgery, SRS, start here since 1975, so almost 50 years. and we change a lot of people's life. Gender dysphoria is affect their thought, their health, their psychology a lot. So after doing the procedure, even top or bottom surgery, it changed a lot of their life. The quality of life come better. They live with happier life. For the question of bottom surgery has so many steps. It depends on trans woman or trans man. If in trans men, yes, it has so many steps in, like to make the urethra or closing vagina together with the hysterectomy, and then to make the phallus, the new phallus, with the tissue from other places like thigh area or forearm area. And after that, the third and fourth step is to insert some instrument or a prosthesis to make it work. But in trans women, we can do in one step because of we do the vaginoplasty with their own tissue, and totally even take a long time, 5 to 6 hours, but it's one step procedure. So the answer is depends on trans men or trans women. I think for the patient and doctor relationship is the most important. They have to trust their surgeon or doctor that take care for them, because it's long time journey, right? And for the surgeon, we have to be honest to our patient. I have so many patient ages. Many of them come first with the top surgery because it's cheaper and easier. Take not too hard to take care afterward after the surgery. And in the middle age group come for the bottom surgery, and for maybe get older, they come with their finish their life, the family accepted. Someone come with their wife and their daughter and their son, come for changing life at the end of their life.
Let me talk about the origins of Pride Clinic. So, Bumrungrad executive recognize the value of the diversity and inclusion. So, one of the diverse populations in the world is LGBTQ. So, they have faces health disparity as well as healthcare discriminations for a long time until now. So we want to create the safe space and the best healthcare services for them. Although maybe, just from the foreign people look at the Thailand as maybe the land of paradise for LGBTQ peoples, but from one of the research from UNDP show that that's not true at all. So that's why we want to create one of the model like a Pride Clinic that to heading that we embrace all DEI concept. I would like to affirm that transgender identity is normal, not a psychological or psychiatric disorder. Transgender have distress about themselves. They have a psychological distress because incongruent between their gender identity and their sex assigned at birth. So now current treatment that we want to align their body with their true gender identity. The success of the gender affirming care, not only you provide the optimal hormone treatment or the perfect gender affirming surgery, but the best thing that your patients can live their life as the way that really they are in the society. But I would like you to know one of the best success for gender affirming care is the parental and family support.